Hi, this is Dr. Mora. I'm at Restore Orthopedics and Spine Center. I want to show you a really interesting case. A young athlete here with pain over the front of the shoulder. So they presented with pain in the front of the shoulder. The exam showed tenderness in the front of the shoulder. So MRI showed a rotator cuff tear as well as some tearing of the biceps. So here we are. This is what we have. Let's look back down here again. Left shoulder, camera's in the back, probe is in the front. Now we go to the screen. Here we go. That's my probe. It allows me to move things around. A little frame of the labrum. Let me just tell you where we are. Ball and socket, glenohumeral, also known as the glenohumeral joint. The ball and the socket of the shoulder. So let's look around. Let's take a tour, and here is the tour. We go to the front of the shoulder. There's the biceps. The biceps has some damage to it. I've already looked at it. It's got some frame actually towards the base. Some thickening, labral frame that could be causing some of the pain. And then, more importantly than anything else, is this rotator cuff tear that we see to the right there. That's a flap tear with a tear of the rotator cuff. So today's project is left shoulder arthroscopy. We're going to clean up this labral frame. I'll do what's called a biceps tenodesis. That means I'm going to attach it up there and remove this little area. Rotator cuff repair. That's the goal today. Dr. Mora here, bringing you more cutting edge orthopedic surgery. Thank you. Spray tissue with a shaver, just like that. There we go, cleaning it up. Thank you. That little flap tear in the rotator cuff. Let's clean it up while we can. I know this patient has pain in the front of the shoulder. They were tender in the front of the shoulder, so what I do is I make sure that I check all the structures in the front of the shoulder. It makes sense because that's important because whatever is causing pain is probably in the front of the shoulder. So initially I thought this subscapularis, this beautiful looking tendon right there, I thought that maybe it was okay, but I wasn't done with my evaluation, and this is how I finish the evaluation. I look at it, rotate my camera a little bit, and look, there's actually frame of the subscapularis. Another reason for the patient to have pain, so what I'm going to do is I'm going to shave these fibers and then go from there. Thank you. Like I said, it's very important to understand where the patient's pain is at as far as the location, and then spend time looking at all the structures in that location to make sure that you don't miss the pathology. Thank you. Rotate a little bit more. There we go. Passing sutures from the biceps. We're going to do a tenodesis. Thank you. So I'm going to leave that. So we've got two sutures that are locked into the biceps. Now I'll be using a striker anchor to attach this biceps onto the humeral head. Thank you. We're going to release the biceps now with this arthroscopic scissor. Thank you. This is striker omega anchor. So I'm going to pound this into the desired spot on the lesser tuberosity. Okay. Find the right spot for my omega anchor right there. We've got my sutures, and I'm going to pound this in. So this omega striker screw is going to hold it in. It's going to fixate it. I follow the sutures in, following the sutures in into the actual initial pilot hole. More here, so we finished the biceps tenodesis. It looks absolutely great. It's attached right there by the subscapularis. The biceps is right there. Next is fix this rotator cuff tear. So what I do, if you look down here, I'm going to move my camera to the subacromial space, just like that. So I went from the glenohumeral joint, subacromial space. That's where we are now. Thank you. Spinal space, subacromial space, acromion, we're right under the acromion. There we go. Defining the tear a little bit better. Greater tuberosity bone right there. Tendon tear. Defect right through there. Okay, so I'm going to clean this up a little bit more, then I'm going to roughen up this bone, which we're going to see here in a few minutes. Thank you. Okay. Striker speed anchor. I'm going to use it to anchor down this posterior aspect of the rotator cuff, also known as a rotator cable. More here. So this is what we've done so far. I put in a Smith & Nephew Q-fix anchor in the front, Smith & Nephew Q-fix anchor right there, speed anchor, right there, I'm going to, before I tie this down, before I tie these sutures down, what I do is I make these small vascular channels in the bone. Why do I do this? So I can draw in some of that bone marrow blood. Bone marrow blood contains stem cells, platelets, and other proteins that will help healing. So that's what I'm doing now, creating some vascular channels before I tie down my tendon up against that bone. Thank you. Loading up the Smith & Nephew first pass. Just going to help pass the sutures. Thank you so much. Go in. See what happens when I tie these sutures down. As I tie them down, this bone. And that's what I'm doing now. I'm tying down these knots. Is tying these sutures. So I tie on the outside. Go half hitch, slide my little knot pusher, which is like a finger. Push it down, there's the screen. There it is. Tying down my sutures that I already passed in. Alright, Dr. Mora here showing you the home stretch of the case. The home stretch, this is what we have. Left shoulder, rotator cuff tear, biceps tenodesis. I did the biceps earlier. I used a omega anchor from Stryker to do an intra-articular biceps tenodesis, and then I did a rotator cuff repair. And this is the repair. You see all those sutures, a double row type of technique, using a Smith & Q-fix anchor. There it is. Rotator cuff firmly tied down up against the nice bleeding bone right there. Q-fix anchors and Stryker speed anchors over there. Rotator cuff repair. The last thing I'm going to do is I'm going to clean up the chromium over here and take off a little spur right there. And sometimes the spur can bite down on the rotator cuff repair. Let me show you the repair. It's down there. So what I do is I use a burr, a high-speed burr, which is like a Dremel type of device, and I remove it like this. Just some of the details that we do associated with rotator cuff repair. Removing the spur just to make sure that it doesn't bite down and damage my repair. I hope that's helpful for those who have shoulder pain and who have been told they need a repair. You guys take care. Have a great day. Thank you.